And then you're good to go.
Good afternoon. My name is Jacquie Cutts. I'm the Public Health Nursing Manager and Operations Section Chief at the Crosse County Health Department in Crosse County, Wisconsin. I am filling in for Jennifer Rombalski, who's our Health Director, because she is off today. I wanted to start today by just going through case counts to tell people where we are. We have no new cases of COVID-19 in Crosse County. That means that our total is still 26 confirmed cases of COVID-19 with 0 individuals currently hospitalized, 0 deaths, and 25 of those 26 individuals having recovered. There was 1,647 negative tests in total as of today, which brings the total number of tests completed to 1,673. That does not include any tests that are still being processed at this time. The state of Wisconsin has increased by cases 225 new positive cases from yesterday. That brings the total to 4,845 positive cases of COVID-19 in Wisconsin. Individuals who are hospitalized from COVID-19 include 1,302, which is an increase of 50 from yesterday. 26% of cases have been hospitalized. There were 246 deaths, which includes an increase of 4, with 49,502 negative test results. That means that there's been 54,347 total tests done in the state to date. The next topic I wanted to talk about briefly is just a reminder about the symptoms of COVID-19. So most common symptoms include fever, cough. Sometimes that's dry, sometimes that's productive, which means you cough things up at the time that you have the cough. Can also be muscle aches. Some small percentage of cases do have stomach upset, so that would be diarrhea, vomiting, or nausea, also abdominal pain. But the primary symptoms that you want to be concerned about are fever and cough. Those are the 2 big ones. Sometimes sore throat also. So just a few reminders on how you can protect yourself. Physical distancing, staying 6 feet away from other people as much as you can for people that are outside your home. Staying home to reduce your exposure, only going into the community when you need to, sending 1 person to the grocery store or to other essential activities instead of multiple people, wearing a fabric face covering for essential travel, and then doing things like frequent hand washing with warm water and soap, and then cleaning high-touch surfaces in your home. So those are things like doorknobs, handrails, counters, things that people are touching often. The reason that we keep harping about those specific things is just because it's our first line of defense against disease. We do have community spread here in our community. The reason we know that is because the contact tracing process that we do with each positive case, we try to identify in the 2 weeks prior to developing disease where somebody has been and where they might have come into contact with COVID-19. We can tell you that just over a quarter of cases, we don't have a way to attribute the case to a specific exposure or a specific travel-related activity. And because we can't attribute it to either of those specific causes, we do consider them to be community spread. The next topic we wanted to go through is just what it means if we have the majority of our cases that have recovered. And we understand that there's a lot of frustration about this topic. How do we know if there's community spread when we have such low numbers? So just the process that I was talking about a few minutes ago, and that really thorough contact tracing and going backwards in time and doing a good job with history, understanding where somebody might have come into contact with the virus. That's how we know that about a quarter of our cases have come from community spread. But there are members of our public that have pointed out that this is really only one part of the story. There are individuals that have symptoms that haven't been able to be tested. There are also individuals who had symptoms and didn't go to seek care. So we do anticipate that this is really only one piece of the story, and there are probably other individuals in our community who have had COVID-19 and aren't reflected in those numbers. And that means that the best thing that we can do to protect ourselves is being really aggressive in terms of those prevention techniques until we get to a point that we have really widespread testing. We are actively working on that, and we've received questions about what it means to be actively working on that. So we have regular communications with our healthcare partners. Both Mayo and Gunderson are trying to expand testing significantly, getting access to the supplies and specifically to reagent, which is a chemical that they need in order to conduct those tests. Those things take time. And as they've been aggressively having those conversations and trying to get access to the supplies that they need, we have been trying to utilize those other prevention mechanisms to just keep our community safe. And that's why we continue to talk about that. There's a lot of plans that are coming out right now. So the biggest topic of conversation that we have here in the health department and certainly in the community is just thinking about how we're going to reopen our community. We very much empathize with all of the people who have lost jobs, who aren't able to work, for our small businesses that are really struggling right now, and the need to get back to work and get our economy moving again. So a lot of plans are coming out. We have had one from the White House. We've had one from Governor Evers with the Badger Bounce Back Plan. We are seeing some plans that are coming out from specific businesses, from municipalities. And really all that means is that everybody wants to see a return to the economy. And there are slight differences in each of those plans. And we're working to figure out what are the best elements to have and what we should be collectively working towards. But we're all working towards that one single goal, which is returning our society to normal. And I thought that it would be helpful to talk about an analogy that we use here in the health department in terms of a faucet. So if water flowing through a faucet, if the water is the number of COVID-19 cases and the faucet are the prevention mechanisms that we have in place, if we see the number of COVID-19 cases going down, we want to open the faucet back up, because that's really where we allow greater mobility in our community, where we have better economic outcomes, where people aren't having the same kind of economic hardships that they're facing now. We want to be able to open that faucet up. But if we were to open it too quickly, we would end up with additional waves. So we've kind of had this graph we've all been following, right, in terms of the number of cases and where they've been going, and now we're coming back down because we haven't had new cases in a while. But as our community opens back up, and as the state and the states around us open back up, we're going to have the same kind of mobility of people that we had before, which means that there may be additional waves of cases, and we want to make sure that our community is prepared to handle that. That means that our healthcare systems are able to handle an increase in cases if they were suddenly faced with that. It means that our public health system has the ability to do that really thorough contact tracing. So that just means that for every person who's positive, we identify everybody that they were in contact with when they had symptoms or in the 48 hours before they developed symptoms, that we're able to talk to those people and ask those specific individuals to stay home and to monitor for development of disease. Those kind of things take time to be able to facilitate that at a really high level. And that's what we've been working on in this interim time, and why we appreciate so much that our community has been so responsive to those requests. So we really are aggressively talking about how to reopen the community in a way that is intelligent and protects people without incurring that risk of, additional waves. If we were to have additional waves, we might have to bring back those mitigation strategies and have lockdowns again. And that's what we're trying to avoid. So we want to open the economy and our community in a way that is intentional and tries to prevent the duration or likelihood of having additional shutdowns in the future. So that's part of what we've been talking about. And then just kind of the point of that process, reopening our community, having an understanding of where the disease is going and being responsive to whatever that looks like. That's something that we get at together. It's not something that any one of us can do independently. And it really is about the work that we accomplish together as kind of a united front. So our health director, Jen, has been saying that repeatedly. We're not fighting each other, we're fighting a virus. And it really does come down to the work that we're all doing together, and how grateful that we feel at the La Crosse County Health Department to have been part of such a responsive community that's willing to think critically about those things and really try to be intentional about how to get our community back going in an intelligent way. And that's what I had today. I'll take questions.
Hi, Marcus from News 19. Has there been anyone tested because they were concerned they might have been exposed on election day?
From our knowledge, we have not had any individuals tested from an exposure on election day in our county. We know that that has been a concern in other counties across the state, but to my knowledge at this particular moment, we have not had that in La Crosse County.
Hi there, Justin from WKBT. I know on Monday Jen had talked about reopening and kind of discussion about reopening some of the campgrounds, and I know some of the other counties are kind of announcing their plans today. I guess what are our plans on kind of reopening campgrounds or kind of making it more accessible for people who want to camp?
Yep. So our internal team has been working with Jen, our health director, and with the campgrounds themselves to develop those plans. There will be a release coming out about that information either tomorrow or Friday, and it will have a lot of specific details about what will and will not be permissible.
Hey, Jackie, it's Mike with WXOW News 19.
Hey, Mike.
Hey, I just wanted to ask you a quick question. We've seen a couple of sheriffs throughout Wisconsin decide not to enforce the safer at home order. What would you say to them?
You know, I think everybody's doing their best with the information that they have. We are really grateful that our own law enforcement in our community and all of our first response, who we meet with on a regular basis, have been unified with us in being in support of the safer at home order. And like we mentioned before, there's kind of this analogy with a faucet and turning off the faucet when we need to stop the flow of disease, in trying to turn it on when we don't have as much disease and trying to reopen our economy. But we really do need this extra time to get a lot of those facets in place. So the Badger Bounce Back program talks a lot about wanting to see a decline in the number of cases, and we've certainly seen that. But there are a bunch of other aspects of the Badger Bounce Back program that aren't quite in place yet. So making sure that our healthcare has the capacity to deal with a surge of cases. If we opened our community back up and we were to see a second wave of cases and it was a higher number of cases than we've had in this first wave, we would want to make sure that our healthcare system has the capacity to handle that. We also want to make sure that our public health system has the ability to do really thorough contact tracing. So if we're trying to ramp up testing and we do a whole bunch more tests, we're likely to see additional positive cases because we've increased the amount of testing. So making sure that the healthcare system can handle those cases and making sure that the health department and our public health system can do the level of contact tracing that might be required, we really need the time there to facilitate that happening and then to be intentional in the way that we open up our community. So La Crosse County Health Department and our partners are very much in support of the Safer at Home order and the extension that Governor Evers has put out, because it will allow us the time necessary to be intelligent in the way that we open up our community and in ensuring that when we do open up the community, it can be more longstanding and that we won't have to have those mitigation strategies go back into place quickly.
We have a quick question from Facebook regarding a fever and what number you're looking for if someone has a fever.
Yep, so the number that we've been using, normally it would be 100.4 degrees Fahrenheit. The CDC allowed decreasing that number to 100 degrees Fahrenheit, particularly with regards to healthcare, but because we have been recommending that number. So 100.0 degrees Fahrenheit is what we have been considering to be a fever.
Marcus from News 19. From a health professional's perspective, what is your guys' opinion on the GOP and their lawsuit against Evers saying that he was overreaching?
Well, as I mentioned before, the La Crosse County Health Department very much feels that the Safer at Home order is appropriate. We very much support it. We think that it gives our communities really valuable time to prepare ourselves for a second and third wave of cases. And what we don't want to see happen is if we were to get rid of all of those requirements right now and everybody were to go back to life as normal, we would likely see an increase in cases and it might be much worse than it was previously. And then we would be back to where we were at the beginning and having to reinstate those same strategies to a pretty extreme degree and then having massive shutdowns again. And that isn't going to be good for our public, for our residents who live here, for our economy. We want to be able to do that really intentionally. And that means that we need time to make sure that all of those other facets of the plan have been operationalized. We need the time to really prepare ourselves, and having the time that is extra from that order will facilitate us doing those things. But if we were to go back to life as normal next week, or the week after, we are worried that we would see additional rises in cases and be back to where we were in the beginning. And we would rather, see a more sustainable return for the economy, so that it isn't something that we have to just keep going back and forth with.
Justin with WKBT again. You had brought up that, quite a few people have already recovered, and although we don't have enough testing kits, I should say, to test everybody, that there probably are some people out there that still have it. I guess with that risk of going out and kind of going out into the public, are there a lot of people that are kind of asymptomatic or really don't show symptoms of COVID-19 but still have it?
So there have been case reports from across the country that there is asymptomatic spread. So there was an instance in Winona. There was also an instance in Boston where there was more mass testing of people who didn't have symptoms, and there were a significant number of people that didn't have symptoms but did test positive. And that helped those people in those locales. So one was in a long-term care facility, one was in a homeless population, where they'd had outbreaks and they couldn't really figure out who was being the vector of disease because they'd done all those other mitigation strategies and hadn't been able to really lock it down yet. So by testing a lot of people, they were able to identify asymptomatic folks that they thought might have been contributing to spread. But the degree to which that contributes to spread really isn't clear yet. And we want to be as evidence-based as we can be. And I don't think that we have a really good assessment of what percentage of people with COVID-19 are asymptomatic and the likelihood that they are spreading to a lot of people. But it is something that we're very concerned about. And it's one of the reasons why we recommend really only having essential travel right now and trying to kind of gradually open up our community with a lot of those mechanisms still in place. So if you're going to go out and go shopping, it would still be ideal, even if our community is starting to open up some, to send one person in a household instead of all of them if you can avoid it, to going into the stores that you need to and not going into stores that you really don't need to go to right now, in wiping down your carts, and when you leave, washing your hands. All of those kind of things help to protect us from anybody that could be symptomatic and walking around those public locations, but also people who may not know that they're ill and might be asymptomatic and spreading the infection until we know more about that piece of the disease.
This is Caitlin with WISM. Jen had mentioned at the last press briefing that we are expecting to see a rise in cases. I believe you said that as well, because we are ramping up testing. Any idea of when we can anticipate to see more cases? I know that that's almost impossible to give a definite answer for, but any idea of if and when we will start seeing those increases, and what has ramped up testing looked like in La Crosse County?
So I know that Gunderson and Mayo are both really intentionally trying to bring more testing online. I know that Gunderson was in the process of bringing on some new technology that would facilitate expanded testing this week, hoping to see that up and running within the next week. So I would expect to see an increase in our regional numbers over the next couple of weeks as testing starts to ramp up. But I think you're right in what you alluded to, which is that it's hard to really predict that. And I also think that, we're really fortunate to have been in a community where people tried to be pretty compliant and stay home whenever they could, which I do think has been successful in decreasing the spread of disease so far. So it might take a while where we don't have a huge increase, but then as our community starts to become more mobile and we're more moving around and we have more influx of people from other counties or from other states that are coming through our region, we might see additional waves in the future. So we might see more cases in the next 1 to 2 weeks while testing increases. We also might see more cases in the next several months as we have greater mobility with those other states around us, with the other counties around us, and we have greater travel in and out of our region. So I would say that isn't going to be a done story in the next couple of weeks if we don't see a rise in cases. It doesn't mean that we're not going to see a rise in cases in the weeks and months after that. I think it's just kind of an evolving process that we have to be adaptive and flexible in understanding what's happening at any particular point in time and then being responsive to whatever that looks like.
Justin with WKBT again. We've had quite a few questions on kind of opening up the economy and still having some of that preventative efforts to try to limit the spread of this disease. But I guess I'm sure Wisconsin's not the only place that is having this kind of issue where they're kind of debating whether to open up the economy or not. But if we do something like this, are we kind of putting ourselves at risk for kind of going up and down, having with these stay-at-home orders, kind of constantly throwing through until, a vaccine is kind of released? Or I guess, is there
Right.
kind of a strategy?
Yep. So I think that you're right on par with, until we get a vaccine that is able to be deployed in mass to a lot of people to really achieve what's called herd immunity. I think that we will have waves of cases, and that's going to be a reality for a while until we have that vaccine on board. So part of the strategy that we're developing internally and trying to look at the different strategies that are out there, the different plans that have come out, and being intentional about different trigger points. So we've been talking about, when do we need to really utilize those mitigation strategies related to data and what our current capacity and what our current trends actually look like, versus when can we open up our economy and how is that going to look? So thinking about a phased approach. So when we start to lift those restrictions, not just doing it all at one time, but doing it in phases and really making sure that the level of opening that we have isn't increasing the risk to our population, so that we're trying to balance the need for an open economy with the need to protect people and safeguard their health and survival. So trying to do that in a really intentional way to mitigate any of those potential impacts and achieve the best long-term result. That's part of the discussions that we're having, both at the health department, with our healthcare systems, with all of our partners throughout our county here in La Crosse and throughout our region, really trying to be intentional in that conversation so that we don't have exactly what you were describing, where we widely open the community, go back to life as normal, see a huge spike in cases, have to just go on lockdown again, and then just have this kind of accordion where we, open up and then lockdown and open up and lockdown. We want to avoid that. So instead of doing that, we want to kind of open up our community in a really intentional way to prevent that from happening and to reduce the likelihood or the duration of any kind of shutdowns. We want to be able to, keep people working as long as we can and keep them as healthy as possible.
Marcus from News 19. Is the new DHS website thing, the hospital capabilities, is that a part of this strategy as we start to talk about reopening?
So the specific strategy conversations we've been having are along 3 different lines. So they include epidemiology, which is really the study of the disease and the number of cases we have and what the trends look like. They look at healthcare capacity, which is kind of where hospitals are in terms of their ability to handle cases, to handle both severe cases and testing capacity. And then it looks at public health. So that's both our internal capacity at places like the health department and at public behavior. So in each of those 3 categories, we're talking about what criteria do we need to think about when we can open up the community? What kind of guidance do we need to give to businesses, to our community, to the public in general? Where can we have kind of synergy in how we can keep our risk down as much as possible while we open up the community? And then if we had to go back to some mitigation strategies, how could we implement those along the same lines? So that's certainly part of the conversation, where our hospitals are at, and that's part of what are our triggers for when we can reopen things and in what way. I think that's certainly part of that conversation, and not just at the state's website, which is a wonderful resource, but also having those conversations directly with our healthcare partners, and Gunderson and Mayo and kind of some of the other private facilities that are throughout the county. They've all been really good partners in being able to be really responsive. We talk to them on a weekly basis, multiple meetings that they're in every week. We just feel very fortunate to have a really responsive healthcare system and the partners there that we do, because they are so willing to work with us and be kind of a united front.
Caitlin from Wisdom again. We had a question on our Facebook Live feed asking if there have been any false negatives for COVID testing, and if so, what the percentage of that has been.
I cannot speak to the percentage of false negatives. What I can tell you about is why somebody might test negative and then test positive again later. So the way that the tests are done, They're either swabbing, back here. So your nasopharyngeal, that just means like pretty high up in your nasal cavity, or your oropharyngeal, which just means the back of your throat. Or they can also do a sputum sample, which is when you cough something up from your lungs. So those types of testing, if there's not enough virus present in the sample that they get, if they either don't get the sample well enough because the patient was squirming, that's particularly prevalent in kids if they're around and hard to get at, or if there just wasn't enough virus there because somebody wasn't that sick yet, then they might test negative. And then if they continue being in isolation, which is what we recommend to people, if they are being tested because they had an exposure and they were symptomatic, we are asking them to stay in isolation until certain criteria are met. And the reason that we make that request is because they might become more severely ill over the next week and then could be retested again. And there has been an instance where that happened, where somebody had an exposure, was mildly ill, tested negative, stayed in isolation because that's what they were asked to do, and then a week later did test positive. It doesn't mean that the first test was a false negative. It means that there wasn't enough virus to turn it positive at that time. That's not, I think that's only happened in one of the cases that I can think of. So it's certainly not something that's been prevalent so far, but it is something that we think about. And it's part of the reason why we encourage people who are symptomatic to stay home when they're ill, because if they do become more severely ill later, then we can advocate potential retesting them, especially if they've had a known exposure.
Marcus from News 19. The new data represented in the hospitality capabilities webpage, how accurate does that represent Western Wisconsin counties in their emergency response?
I haven't looked at that data yet today, so I can't really comment about that. I can tell you that our hospitals in our county are sitting pretty well in terms of PPE, and their testing capacity is increasing. I know they're trying to get access to additional reagent to facilitate more testing. I know that they have really good staffing capabilities right now, but there are some smaller hospitals throughout our region that do have some greater concerns in terms of those different facets. I can't comment about the actual about that actual website though, because I haven't reviewed that in the last couple of days.
Marcus from News 19 again. So with Northeast Iowa cases that are growing a little bit, and some of them who receive healthcare in La Crosse, is there any concern that it could spread while they're like traveling back and forth?
So I think that's a really good question. We have people, so our healthcare systems serve a 21 county region, and there will always be mobility because of where we're located in La Crosse, being so close to Iowa and really close to Minnesota. We are going to have that mobility where other communities in our state might not. And that's one of the reasons why we think it's really important to have really good prevention strategies in terms of, if you don't need to be out, stay home. If you can work from home, work from home. If we're going to reopen the community, we need to do that in a really intentional way. And it shouldn't just be return to life as normal, because we do have greater mobility in terms of residents from other counties or other states coming through our community. And we want to be able to really mitigate that risk to the best extent possible. And that means that those normal prevention strategies are kind of our first line while we are in the process of increasing our testing capacity and in bringing additional partnerships online that could help to mitigate that risk in a different way.
Do we have any additional questions for Jackie today? Looks like we have one more.
Marcus from News 19 again. Do you have any guidance for people who are maybe performing concerts outside, for people at nursing home facilities or those other birthday parade things?
I'm going to have to defer to our community outreach group. I know that there's been some communication that's been sent out about that topic, but I'm not going to paraphrase it because I don't want to get it wrong. What I would say is that if we don't need to be doing something, we shouldn't be doing it until we have sufficient testing capacity and we have very specific guidelines in place to facilitate greater socialization and opening up the community. We want to mitigate risk wherever possible. So in terms of activities that we might be doing out in the public, we would encourage you to really think about whether they're necessary. And if they're not, then try and be close together by being far apart. So that means we want to protect our people in nursing homes. We want to protect our loved ones, our kids. We want to protect our friends. So Skype them or FaceTime them or find other ways of connecting, because keeping that connection is really important. But we don't want to see cases where we might be putting people at risk. And so we would just caution against that.
All right, I am not seeing any additional questions. Any last
right.
thoughts, Jackie?
We just want to appreciate how difficult this has been for our whole community. I have 4 kids myself. I completely understand what it is like to be trapped indoors with your children for a long period of time. I can appreciate how difficult it is for small businesses. My family owns one of them. So I just want to appreciate the amount of responsiveness that our community has been providing. I know that it's not easy, any of the things that you've been asked to do, and we're just so grateful to live in a community where people are prioritizing public health and really seeking to follow that evidence-based guidance. So thank you so much.